Test, 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 test. Test 1, 2. Okay. Ladies and gentlemen, welcome back to Mike, the premier business radio program around. I'm your host, Mike King. I appreciate you being here with me. So today we're coming to you from Dandelion Health. We're with our friend, Dr. Joe. You were here. We were talking to you before, but now we're at your location.
That's right.
All righty. So this concept is tell us who you are, what you do, and then we're going to talk about the facility right here.
Yes, I'm Dr. Joe Fields Johnson. I'm a family physician. I'm here on the south side of Richmond on Hull Street in Blackwell, next to Manchester. I have Dandelion Health Direct Primary Care, is where I provide family medicine services to the community. And we have a really unique model called Direct Primary Care.
Yes, it is unique.
Yeah, absolutely.
So, alrighty, so you're here. Let's talk about the process.
Yeah.
So it's not what, a person says they go to patients first or they go something like this. This is, you're taking the services directly to the people. You're having people come directly to you.
Yes,
but it is a subscription, it's not a subscription model, but sort of.
It is, in a way, absolutely. So people become members of our practice. And we only see people through that membership. And it's an excellent opportunity for people who don't have health insurance, who have a really high deductible, and they can't get in, or someone who's just frustrated with their care and wants a more dignified experience. Our goal is to be cost transparent, dignified, and accessible for my patients. And we get them in the same day. If they have a concern, we text them, we do video visits, or we help settle things even without coming in, which is really nice.
One of the things, and I didn't know that so I meet your dad, and it's faith-based. I mean, what he had talked, not so much the practice,
right?
But does that say something about your ability or desire to want to do something like this? It's not the regular medical model that people would think.
Sure, yeah. Well, our model is not faith-based, actually.
It's not faith-based,
yeah.
But the idea of it is.
Sure.
So the reason for my radio show is helping people get, do more, and business helping society be better. Absolutely. That's exactly what your business model is.
Totally. When I went into medicine, one of my foundational goals was to really change how people are healthy and stay healthy. And our system is so separated. There are some people who have great access, good care, so many people who don't. And that's really heartbreaking. And I wanted to be able to participate in caring for people that's dignified, helps them achieve their own health goals. And that means, making it more affordable.
How'd you settle on this location here?
Well, here in Southside, there are not many healthcare services. There are very few physicians here in the Manchester Blackwell community. There are a few. And then the largest uninsured population in the entire city is right here on Southside, in the East End, and I'm right between both of them. And so if you look at, I was just looking at a map earlier today, where my patients come from. They come from Southside, they come from the East End. And I have patients smattering everywhere else, but that's really where they are. That's why I'm here. And I speak Spanish. And there's a large Spanish speaking community right here in Southside, which is great to do.
So when you explain to a person the practice, there's a look of not understanding at first.
Sure.
Let's talk about the moment when the light comes on and they get it.
I would say one moment is a relationship with a doctor. I think many people really want to feel comfortable, to have someone who knows them, who knows what someone's been through in the complexity of their life. Because there's a lot of meaning to that relationship. And so that's one piece, that I am committed to that relationship and helping people get the care from me when they need it, how they need it. And then the next piece is how affordable primary care can be. If we remove insurance barriers, take a lot of the administrative costs out of the care, we really focus on that direct care between me and my patients, it can be quite accessible and affordable for most people.
And people don't know that.
Most people think that healthcare is extraordinarily expensive.
Yes.
You can't get in, you have to wait many months. And that is typically true. But we're trying to really transform that with this model.
One of the things, so I was in the Army for a long time and I was a medic.
Yeah.
I was on a team with people who did other things. There's the demolitions person, there's the communication. Yeah. But I was special because I could make people's sick kids well. Mm-hmm. It's one thing when you help the parent, you help adults, but when they bring their child here and you're able to help them, and maybe
Yeah.
they, let's talk about what that look and feels like.
Yeah, well, I love taking care of kids. I take care of newborns. Actually, the first visit for a newborn is a home visit because it really helps mom and the family just be settled, be at home.
Really?
Yeah.
So you're doing that old school style, a doctor
Yeah.
coming to the house?
That's right.
Okay, that's old school.
And if you look at my website, there's a map of areas where I do home visit. I go on my bike to people's
I
houses.
saw you with the bike when you came to the Hilton.
That's right. Yeah.
Okay.
Yeah.
So the doctor rolls up to my house on a bike.
That's right. Yeah.
Okay.
Yeah. And coming back to taking care of kids, it's such a powerful thing. Kids are resilient and they're teaching us the beauty of life every day. And in that encounter, most of the kids I take care of, their parents come in too. So I help care for their parents. They have a question about something, they want to refill. It's efficient for them. They feel like they're well cared for. And that's really powerful for me.
Let's talk a little bit about the Dandelion process. I hear about you. I show up at the front desk. What happens?
So you sometimes happen before you come to the front desk. You can text us, call us. We'll answer your questions. Come to the front desk, same thing. We tell you about how the membership works, about the services we have. And then if you're ready, you sign up. We have an online form, which you can fill out here on a tablet or on your own time. Sign an agreement, we get some medical history, then we get you started. We have an hour-long initial visit for everybody to really make sure we know you and what you've been through, your care team, your other physicians that you see, and all the medications and things that you've been taking. So we make sure that you're on appropriate treatment and we make a plan to follow up. Of course, we can't take care of everything that first visit, but we make a plan together. My goal is to know what's Mike's goals today. What do you want to make sure we manage? And then we make goals together for the next few months.
From the business model standpoint, this is something that when I told people who you are, what you did, the people were just shocked.
Right.
It's like, this is unbelievable. Right. And one of the things that we talk about is sustainability, doing this because, you're one person, you're doing like the Superman thing because you're giving patients time. And that's one thing that people always talk about when they go to the doctor. The doctor's kind of like, he has sneakers on because, he came in and he heard what you said and now he's gone.
Right.
But you're doing something totally different.
Right. My goal is to really have more time to provide the breadth of services that my patients need. And the model is sustainable because patients really value that. And they want to have someone where they can go and trust and have the complexity of what they're going through cared for in a dignified way. And so my goal is to have a certain number of memberships, but enough that I can really care for each one of those people in a personal way. And
you had talked about concierge medicine is not just in income challenged areas. You're saying this isn't a revolutionary model. This is working. Right. This is definitely working. And I would call this, some people call it working class concierge because it's different. You don't have to have insurance for it. And we make things simpler and more direct outside of those other practices that kind of have a very different model. I completely agree. It is sustainable in this community and we can be successful, and it's good for me. It's good for our business, but it's also really, the most important thing is really good for our patients. What has the reception been when people walk by and they wonder what Dandelion Health is? Yeah. And then they pop their head in and how shocked are they? I had someone pop their head in today. He was talking about, some of his healthcare needs. We won't go into any specifics, but he's seen someone else, but it's hard to get in. He lives right here in the neighborhood, and he was just excited to first know that there's other options here. He had to process a little bit kind of what the membership is like, but he's like, you know what, I'm gonna really give this a thought and think about it. Gave him some information. And that happens, every other day. Someone's coming in, popping their head in, wanting to learn more about what we're doing. From the business standpoint, this is on the Mike and Mike, ESPN Richmond, that's where you find us, as well as the Choice 105.3. This is part of the Mike King Biz Radio Network, as well as International Business Growth Radio. That is Saturdays at 10 a.m. in the East. When you had this idea and you're putting it into fruition, what was the hardest part or the most shocking part about turning this from an idea into a business? I think, I'm a new entrepreneur. Like, I haven't done this before.
And in the healthcare settings I've been in before, I was employed, everything was set up, walk in and take care of it. Now I'm truly have to take care of every little detail, from helping find someone help me with branding to the accounting to everything. And just the most surprising thing was seeing the slow growth and the pieces fall into place over years. It's been 2 years since we opened, and really having to just be patient and trust the process to know that it will work. Because I know how valuable this is for the care that I can provide, and just believing in it and having excellent support. My wife is a huge supporter of what I'm doing. She's working and has a salary, and that really helps me to be able to be creative and do this. She helps me all the time with the business too. So it's the people around us, my family, close friends, other mentors, have been essential to help me have that belief that this is going to work and the resources to do it.
Alrighty, so you opened the doors. It was a lot of fanfare. You were just happy. When did you realize you had something that it would work?
I would say probably like April 2021,
We're smack dab in the middle of the pandemic, Doctor.
A year after it started.
That great timing. There you go.
Exactly. What people needed access to care about. And it was, a small number of patients, but at that point I had them for, 8-9 months, and they were, really seeing the benefits, seeing some health outcomes improve in their life. And for me, it was a sign that this is really going in the right direction, that it can work. A year later, we moved into this building, and now we've been here for 4 months. It's been great.
Where were you at before this?
I was at a dental office down the street. I was renting some space from them.
On the opposite side?
On the opposite side, yeah.
That was you?
I was renting a space from them.
Okay.
Yeah.
Because a while back I heard about a medical practice that was, and I hear a lot of things.
Sure.
And then it was, once whoever says that press and publicity does not work, they're crazy.
Right.
Because brands are your ticket for people knowing who you are. Because once somebody finds you, it makes it easy for the others, because media is kind of lazy. We follow after, and sometimes you try and go out and do, you try and find the gem that's not showing, so that everyone can get to see. And that's exactly what you're doing right here. Yeah. So how can people find Dandelion Health out there?
So you can come see us, 1312 Hall Street, Richmond, Virginia, right here in Blackwell, and next to Manchester. Our website is www.dandelionhealth.com. And you can find us on Instagram, Facebook at Dandelion DPC. That's DP as in Peter, C. And yeah, we're trying to spread the word. It's been really incredible to meet other businesses. I just put flyers up around the neighborhood on Friday night, and just like the support from other people, and just like seeing them and their growth and their businesses is really powerful. So.
One of the things that we had talked about when we met before was the price of the model, the subscription, the membership cost. I was shocked.
Yeah.
Let's go down. A lot of times you hear it's a great price for young people.
Sure.
None against you, but you ain't got the miles on like me.
Sure.
But I was shocked when you talked about what the membership would be for someone. I'm 62.
Sure.
So give a breakdown of that so that the listeners can understand that.
So your first appointment is $75 to open your membership, and that's for that first hour-long appointment. And then each month thereafter, you pay that monthly membership fee to cover your access to our services. And that's $55 per month for anybody below 40 years old. From 40 to 59, it is $75 per month. And 60 or above, it's $95 per month. And if someone has a kid and they're joining themselves, it's only $15 if they're 21 or less per month. And with that, they have unlimited visits. They can call and text. They have access to other services like discounted medications. We have our own pharmacy. We draw blood work here, and it's very affordable, like $2, $3, $4 for common labs that people do all the time.
And bilingual as well, which is very important.
Absolutely.
That way, we're not leaving anyone out. It's an inclusive.
Yeah. So I'm bilingual. So is my staff, and we try to keep all of our materials in Spanish and English, so that's really accessible.
One of my doctor is here with us, and would like to thank you for having me in. What you've come up here with here is amazing. And like I said, we're going to let everyone know because what we do as a business show, we're not the typical, as you saw, we're not the typical business show. When you came in and saw and met some of the folks
Right.
at the Hilton, it's not. It's about how business is helping society be better,
Right.
and that's what I talked about, the foundation of your practice here. Really quickly, so, and this is a lay person, so you're a DO, correct? A doc, okay. So being from Philadelphia, there's Osteopathic Hospital, and that was the one, that was, once we went there, it was I guess a feeling of holistic medicine. Explain to our listeners the difference between an MD and a DO.
It's a great question. So a DO is a doctor of osteopathy, and I went through 4 years of medical school training, the same 4 years that listeners will know VCU, their School of Medicine, where their students become MDs or medical doctors. I had all the same training that they did. And I learned about the osteopathic assessment of the joints, the back, and changes to joints and how they can cause pain and other conditions, and then how to adjust them through gentle repositioning to pushing and pulling and maybe popping and cracking that people might be familiar with at a chiropractor, though our practice is different than that. And so I incorporate those physical assessments and treatment into my general medical care for my patients. So, it comes up, people have a lot of low back pain, for example, and we can help manage it. I have many patients I've helped to really resolve their back pain through that treatment. And I can also help them with medications and help them get imaging if needed, coordinate physical therapy, and really bring a multimodal approach to that. And my goal always is to help people with getting good sleep, good nutrition, balancing stress. We all have stress in our lives, and really thinking holistically about how our lives and what we experience affects our bodies and how we can heal by changing some of those things.
Is it true, or just a perception, that DOs are not as willing and fast to prescribe medications as MDs, or that's just
Right.
people's perception?
Well, I'd say medications are a tool of many. They have their place and they're very powerful and very effective for a lot of conditions. And so absolutely, I prescribe medications. I have my own pharmacy, right? But I think that I also really like to do is to stop prescribing medicines for things that are causing side effects that aren't necessary, or find ways that really have more broader impact, like helping people move their body a little more, helping them choose good foods that can reduce their symptoms without medicines. And that for me is really powerful because it affects other parts of their health too. So I think in general, it depends on the individual provider and kind of what specialty they're in. Because osteopathic physicians are neurosurgeons, they are cardiologists, they're family doctors just like me. And we do all kinds of care, and it kind of depends on the context.
I guess you feel good about something when you get good treatment there. Right. And when we started going to osteopath, that was the first, I guess, the first introduction to DOs. Right. And on top of that, by living in California, I'd been a party to the whole holistic medicine thing. Sure. Very early on. So it was an eye-opening experience for me. So on the mic with Mike, we're here with Dr. Joe. One last time, how can people find it out there?
So they give us a call, 804-251-0402. You can check our website out, dandelionhealth.com, or on Instagram and Facebook at DandelionDPC.
Where did Dandelion come from?
So dandelions, when I chose a brand, I wanted to find something natural that kind of felt meaningful to me. And dandelions are this beautiful flower that's everywhere, that humans are, and they're underappreciated. A lot of people treat them like weeds. They try to get rid of them. They try to take them out of their lawn. But really, dandelions are really powerful. They're the first flowers that come up to feed the bees in the early spring. They have excellent source of calcium in their leaves. They can be used for food replacement for coffee. You can eat the whole plant. So there's this multifunctional, beautiful flower. Primary care should be everywhere people are. It's the first place you go when you really need something, something's going wrong. And it should be multifunctional for your life, for urgent things, for chronic care management, for mental health, and other physical concerns that people have. So I find that unfortunately primary care is also underappreciated and invested by many people. And we are not supported by larger institutions to really flourish and provide the real complex multifunctional care that we can. And so I find that dandelions and primary care have been treated in a very similar way. My goal is to rejuvenate our relationship to primary care through this model. And that way also appreciate dandelions because they're so beautiful and functional. So that's kind of how we came to it.
Ladies and gentlemen, that's what I'm talking about. I wasn't expecting that one. I clearly was not. On the mic, Mike, I always say you bring the best and the brightest, and this young man right here is exactly what I'm talking about. You can catch us every day, 5 to 7 a.m. on The Choice. No, on ESPN. That's where I'm at, from 5 to 7. The Choice is 2 to 3. You got to visit at The Choice. We're right down on Belt Boulevard.
Invite me over. I look forward to reading.
You'll come on your bike.
That sounds great.
That's how he rolls. On the mic, Mike, we'll talk to you soon. Thanks now. Appreciate it.
Thank you,
Doc,
appreciate
thanks,
it.
son. Take care. Have a good one. All right.
That was a great interview.
Thanks, sir.
Both of you.